We're talking about a huge public exposure for the field of IR.
You are now listening to Prologo MD.
Sir Elgar MD, recently Dr. John David Prologo, an IR attending at Emory, was on the Megyn Kelly Today Show talking about a brand new procedure that may help in the fight against obesity. The Megyn Kelly Today Show is a talk show on NBC that generates about 2.9 million viewers every day. We're talking about a huge public exposure for the field of IR. I'm actually fortunate enough to know Dr. Prologo personally. I trained under him. I'll never forget one night we did an emergent tips on a young male executive. That patient started off his day vomiting blood and being admitted to the ICU. He ended his day with a TIPS procedure that ended up saving his life, and he ended up walking out of the hospital. What I'll never forget is what happened right after the case. With tears in her eyes, the patient's wife ran over to Dr. Prologo, thanked him, and then gave him a huge hug. I mean, this is why we're out here doing these cases. But anyways, Dr. Prologo has been hard at work studying the effects of cryoablation on the hunger nerve. This is a branch of the vagus nerve that runs along the back of the esophagus and controls our body's response to hunger. He studied 20 patients who underwent CT-guided cryoablation of this nerve and then followed them for several months. Importantly, none of the patients suffered complications from the procedure, and in fact, all of them reported a subjective feeling of being less hungry. In fact, one of the patients, who happens to be a nurse, was featured on the segment and demonstrated that she had lost about 25 pounds of body fat since undergoing the procedure 11 months ago. I mean, this is huge. I'm really happy about this for a lot of reasons. Number one reason I'm happy is it's nice to see an awesome interventional radiologist, one that I happen to know, get on TV and then say his piece to 2.8 million people. If anyone deserves this type of success, it's Dr. Prologo. He's a nice guy, a friendly guy, a humble guy, and a guy who's definitely pushing our specialty forward. Number two is it puts IR on the camera and in front of people's eyes, exactly where it needs to be. The public needs to know it's not just cardiologists or heart surgeons or orthopedists that are doing big things for patients. They need to know that IRs are innovators, game changers, and most of all, highly trained physicians who are really interested in high-quality, high-impact patient care. Number three, this is new disease territory for IRs. As IRs, we've been busy developing the ESRD space, the venous space, the cancer space, the stroke space. I'm glad that Dr. Prologo stepped up, took initiative, looked outside the box and said, hey, I have this IR skill set. I'm going to apply it to this huge national problem of obesity. I think if you're interested in IR even a little bit, you sort of owe it to Dr. Prologo to reproduce this news in some way, shape, or form. Tweet it, post it on Facebook, maybe make a video about it, or just tell your friends. I mean, how did I come to learn about this amazing procedure? Not on Twitter. One of my techs told me. I mean, that's word of mouth. So, interventionalists are out here treating cancer, blood clots, strokes, and now obesity. That's my story and I'm sticking to it. Big ups to Dr. Prologo. You know who I am. Keep it 100.